I'm Aubrey Sumner. I came actually at one of Matt's introductions to basically why kids have, like ADD, ADHD, some of the things that may be affecting them. So it was really a learning seminar, and I liked what he had to say. Yeah, it's funny because when I first actually met Matt, first impression was family. And I found that even though I had come for mainly my son Leon, that I'd been needing some help too, because I suffer from migraines off and on, and they'd become pretty frequent, suffering usually about 1 to 3 a week, and it was never fun. So usually it's just, you kind of live with it, and you hope that you can survive long enough to get through the day kind of thing and then go to bed. But I'd been suffering far more than just migraines. I actually had been suffering from chronic pain from lower back and neck and shoulders and a lot of different things. So it became pretty intense and bad over the years. So, and then I never really thought about how pain really actually affects us. So it was a change that I needed to take. I've been actually going to different chiropractors before, and the one I had previously gone to, they were okay, but it just didn't feel like anything was changing. So it made it kind of hard to feel like I was satisfied with that. And the one previously that I had gone to before that, they were fine, but they were far away. So I needed somewhere close and be able to also take care of, get my husband to be taken care of, my son. And so that's where we kind of started off, and we did the family plan so that we could actually get it done. I don't suffer from migraines consistently. I've been pretty pain-free in the neck and the shoulders. My lower back, actually, I'm fine, but it's just, they said it's going to be something that eventually you'll have to have surgery for because it's pretty bad. But I'm hoping to avoid that by losing weight, doing things to actually be proactive. Even though they say that I'm better since I've had physical therapy because it was pretty severe. But I'm mostly glad that actually I don't have the migraines, because that really actually kind of puts me out for the day. Because when you're hurting in the head, it's just, you can't really think very well. So, and that's been a lifesaver, honestly. So, and for my son Leon, it's been great because we've kind of just, it's like one day at a time, because he would suffer actually from migraines as well. And usually we found that not taking care of ourselves or not drinking enough exasperated for that. But it's nice because we actually never had a specialist in the C1 and C2 spinal fixing. So all the other chiropractor actually don't usually cover that area, because either they've not trained for it extensively, or they just don't, they want to be overall a general chiropractor. So it's nice to have a specialist, because I've had whiplash in the past, and that actually is part of the issue, is that wasn't fixed necessarily best. Even though I went to a chiropractor right after it happened, it's like they said, soft tissue damage, nothing we can really do about that other than what we've done, which, since then in 2001 is when I had my first whiplash. It's been kind of off and on headaches, maybe once every 3 months, but still, that's not really what I want. I want none. Sometimes we just don't know what really causes little things, but I know that being constantly in pain is actually like the worst thing we can ever keep on going through. Taking medication just to basically ease the pain over days and days won't ever fix it. Tends to make it worse over the long run. So get things fixed and fixed right and not allow your body basically to get so used to it that it pretty much molds itself into that position, because that just makes things worse in the long run. So, and it's nice to actually feel more normal. Yeah, without medication, so a more natural approach. And I know that a lot of people I've met and asked about like what they feel about chiropractors, a lot of them are scared. And that's just because it's a new experience. It's being willing to be vulnerable, because it's working on areas that are pretty vulnerable in general. And people don't realize that it's important to have that, even though, you know, it's scary. But it's important to have them work on it, because like the regular doctors, they actually don't cover alignment. They cover pain management, they cover surgery, they cover just different things like physical therapy, which is great, especially if you're that bad off that you need a little more help with like your muscle tone, because mine was bad. So don't let yourself get that far bad. But yeah, just to get it when it starts instead of get it 3 to 5 years later.